The first 72 hours in prison are not defined by routine. They are defined by uncertainty. During this time, most people do not yet understand where they are, what is expected, or how the system around them actually works. This period is not about punishment. It is about intake, processing, assessment, and control. This is cuffs and change. When someone first arrives at a correctional facility, they are entering a system under pressure. That pressure comes from volume, limited staffing, and strict procedures that must be followed in a specific order. The first step is verification. Identity is confirmed. Paperwork is reviewed. Basic information is logged. This process can take hours, not because it is complicated, but because intake often involves many people and few staff. During this time, movement is restricted. People wait. They may not know what comes next, how long the wait will be, or where they will be placed. After verification, the focus shifts to classification. Classification is how the system decides where someone will be housed and under what level of supervision. This decision is not based on comfort. It is based on risk, available space, and staffing capacity. In the first 72 hours, classification is often temporary. People may be placed in holding units, intake dorms, or restricted housing until a full assessment can be completed. This is why early placements often feel sudden or unclear. Medical screening is also part of intake. This does not mean full medical care. It means basic checks, questions about current conditions, medication needs, immediate risks. These screenings are brief by design. They are meant to identify urgent issues, not to resolve long-term care. Access to treatment often comes later, once movement and staffing allow. Property processing happens during this period as well. Personal items are logged, stored, or discarded according to policy. This process can feel abrupt, but it is procedural, not personal. The system prioritizes control of items because uncontrolled property creates risk. Communication during the first 72 hours is limited. Phone access may be delayed. Information may be minimal. This is not always intentional. It is often the result of intake volume and staff availability. When staffing is tight, movement slows, and access follows movement. One of the most difficult aspects of this period is not knowing what will happen next. Schedules are not yet established. Rules are not yet familiar. People are adjusting while the system is still processing them. The first 72 hours are not representative of long-term incarceration. They are a transition period. A system moving someone from the outside to the inside. Understanding this phase helps explain many early frustrations, delays, silence, temporary decisions. They are not always signs of neglect. They are signs of a system under pressure doing intake. In future episodes, we will break down food, housing, phone access, and rehabilitation. But it all begins here. The first 72 hours. This is cuffs and change.